And welcome to SNSN Sports Community. I'm Mike Benarski along with Rich Canova. And today we have the honor of speaking to an old friend here. We can say old friend now because it's been a while.
10 years.
10 years. Miranda Mahoney from Griswold Pride. So, wow, 10 years.
Yes.
Did it go by pretty quick?
It sure did.
Yeah.
It sure did. Yep. We throw kids in the mix of and moving to Griswold and everything. It went by really quick.
So I can say that, and I tell this story all the time. I even told it at your event because I really think it's pretty remarkable. The very first time I met Miranda when she came in to do an interview at our former location.
No, we did it at Charlene's.
Did we?
Our first interview was at Charlene's. That's how early it was in the process.
Oh my God.
Yeah.
I don't even remember that.
Mm-hmm.
All I remember is that she didn't talk. And she said, no, John will do all the talking. John from CHR,
No, I said
right?
Romeo will.
Romeo? See, I don't remember anything apparently.
Yeah.
Except that she didn't talk. Or she didn't want to talk. But we got her to talk a little bit during that day. Mm-hmm. And she's gone from I've seen from like fill in the blanks for me, but from doing like that, that kind of interview and not talking much, all the way to speaking in front of the Connecticut General Assembly,
right?
Numerous occasions.
Yeah, you know what the hardest part was?
What's that?
I had to speak in front of the whole middle school at a Red Ribbon rally. That was tough.
Yeah.
Kids are brutal.
Yeah.
Yeah. Well, one of the things that
they don't understand. They're not paying attention, right?
I know for myself, it's when we're doing this, right? It's just us.
Yeah.
Right. Whoever's watching, and I'm okay with that because I don't see them. But like when I do like an event, which I don't DJ stuff anymore, but like if I do PA stuff, I get nervous.
Yeah.
And when I said that day that my therapist said, that is true. That is really true. That, said to me that basically, say hello, get them to say hello back. And,
right.
Now everybody knows each other.
I'm not big on speaking in front of big groups either.
I get nervous. People think that because I do this,
they tell you just picture them in their underwear and all that stuff. It's like, nah,
the Brady method
doesn't work. Yeah.
The Brady method. So
I guess Toastmasters helps that, right?
I never went through them.
I know a guy that did. A guy I used to work with. Yep.
Yeah. Let's go back to the beginning.
Sure.
I remember that when we were brand new,
mm-hmm.
and I had met Romeo.
Yeah.
Romeo Blackmar.
Yeah. And
he had said, "All right, you know what? We're going to go ahead and start working with you."
Right.
And I went, "Okay, great." And it was like I didn't know what to do with it because I was like brand spanking new at this.
Mm-hmm.
And we started. That was Putnam Pride.
Right.
So how did Putnam Pride become Griswold Pride? Well,
Putnam Pride didn't become Griswold Pride. Putnam Pride was our mentor coalition. So with the funding that we received, it's a big pot of money. So the government really prepares you to be successful with that pot of money. So in order for a coalition to get started, you kind of have to have somebody to mentor you. And that's where Putnam came in. Putnam had successfully completed, or they were rounding down their 10 years of drug-free communities funding. And in the meantime, they applied for the mentoring grant, which was an additional grant that supplemented Griswold Pride to get started. So that's how that all started that way back then. And then it prepared us. It sent us to a National Coalition Academy, which we graduated from. We went to a couple national conferences down in DC. And, it wasn't just me. It was Griswold community members. We had Lisa Legler from Jewett City Savings Bank. Kevin Skolczyk came.
I was just going to mention Kevin. He was a big part of this at the beginning, was he not?
So the whole reason we reached out. So I was working in Putnam with Putnam Pride. We had state funding. Putnam had the federal funding. And how it came about was there was a tragic overdose death of a young adult from Griswold, and it really kind of shook the community. And this was at a point in the opioid epidemic where people still weren't talking about it. There was still a lot of stigma attached to it. And Kevin went on the front page of the Norwich Bulletin and said, "Look, we have a problem here, and what are we going to do about it?" And that was kind of unheard of back then. So, Romeo and I and John we were sitting in our office and we're like, let's reach out to him. And Romeo knew I was from Griswold, and I was like, okay. So we did. And that was in 2014, because it took a lot of planning to get the coalition established so we could officially launch in 2015. So that was 2014. And then we worked with Kevin that whole year. And then we had our first meeting in February 2015.
Amazing.
Yeah.
So I heard you say that their 10 years of funding, is that all you get is 10 years of funding?
Under this particular grant, yes. Okay. So
Then what?
Then there's different grants so like right now we're funded by ONDCP and CDC. It's called Drug Free Communities, and it's split up into two 5-year terms. We're in our 7th year, so our second term.
Right.
And from there, the state has some prevention funding. And then the federal government, I think they have 2 other prevention coalition funding grants that we would have to apply for, but it's very competitive. And with the state funding, they only open it up to new grantees every so often. So so it's going to be a wait and see what's available type of thing when we come down to it.
Because you're not out raising money on your own, are you?
No.
Money.
Yeah.
So, that's the challenge.
It's very challenging.
Of keeping it going.
And the whole point of the DFC, the Drug Free Communities Grant, is to build the communities or to build the sustainability of prevention within the community. And in some communities, it might look like, the town or the, say, Board of Ed would pick up my position. So there's still a paid staff person. Mm-hmm. In other communities, it's just building the infrastructure. And I think that's what we're doing here. Realistically, I know the community's not going to pick up me, but what I've done and what we've done is built the infrastructure. So Public Health and Safety Committee is now working on some sort of prevention or harm reduction, whatever it is. The schools have so much prevention going on. It's hard for me to keep track of it all, to report it, because I'm not doing the work anymore. When we first started, it was me.
You've networked.
Yeah. And I was doing all the activities. But my job now is kind of like, I feel like I went from being like a one-man band to now I'm like a conductor of a symphony. You know what I mean?
You've really kind of spiderweb through the entire community now.
Yeah,
it's not
just
huge. Miranda,
no,
which used to be
I'm
just
still
Romeo
the mouthpiece,
right.
But it's the community is doing the work, and you'd think, wow, well, what do you do all day? Believe me, when I have to manage the rest of it and kind of keep track of it all to report it on our federal grant, because we have to show, if we're getting $125,000 in funds, we have to show $125,000 in match.
I say where it went, right?
Yeah.
Of course.
Yeah.
Yeah, because you go back to the early 2000s, which was obviously before you started what you're doing. The big thing in town that I recall, and it wasn't me that was involved, it was my son, was oxys. Mm-hmm. And boy, it was like you could get them on every street corner.
Yeah.
I mean, I had a dude get arrested in my driveway at 10 o'clock at night bringing oxys to my son. Mm-hmm. And he went through rehab 3 times through SCAD.
Yeah.
And the third time finally clicked for him, was good. And he got out and he got his shit together. Yeah. And he went in the Army and became who he is today.
Yeah.
But it took three rounds before it happened.
Yeah.
So I know firsthand what you're doing.
Yeah. Wow. Thanks for sharing.
I've been to the facilities that he was in. He was in Waterford. He was in one in New London, and then there was one over in Groton. Mm-hmm. And I've been there. I mean, I got take him out on Saturdays and go get lunch and watch him get pee in the cup on the way back in, and the whole 9 yards. I mean, they do hold you to a very strict standard. And unfortunately, it took him 3 times. But he's over it. He's done. He's married. He's got 3 kids. Yeah, and he lives in North Carolina. He's doing great.
Be thankful that it happened back then, because if that was to happen now, all of that, any street level pill now is fentanyl. That's back
then it wasn't.
Back then, it was the pure stuff.
Never heard of it. Right.
So let's talk about fentanyl for a second. from what I understand, it's pretty much a cutting agent.
No, fentanyl is the drug. The cutting agents are all the additives that go into it. So like the xylazine that's been making its way in, and I don't know what else they cut it with, but yeah, fentanyl is the actual. It's a manufactured, man-made drug, but yes.
So when somebody gets marijuana on the street and not from a dispensary or,
you run the risk.
There's a risk.
So
there's a risk.
Why do they put it in there to begin with? Why do they?
I don't think they're doing that to marijuana. They're definitely doing it to cocaine and crack. Most of the fatalities that we see of are cocaine or crack users now. A lot of, if you're an IV drug user or strictly fentanyl user, you have Narcan and, it's widely available. But if you came to the casino and wanted to have a good time for a night and got coke, you don't know what you're getting and people are dying,
I've seen when I worked for the city of Norwich, I see the fire department come out when we were working at night and to known places and up the stairs they go, and 15 minutes later they're coming back down, and it's like, this is the third time tonight, we know we'll be back. And every time they revive somebody with the Narcan, they get pissed off because you just ruined their high. It was like, dude, you were gonna die. You gotta be kidding me. You ruined your high. I just don't understand what drives that all. I don't get it.
Yeah, well, be thankful.
Yeah, but you see it. I mean, we saw it.
Yeah,
but yeah,
it changes your brain chemistry, How
you become so dependent on something like that, I don't know.
Well, that's another thing. Do people actually can they get addicted to fentanyl? Or is it they're addicted to the crack, which the fentanyl is put in?
Oh, both. Your body would become dependent on both of those substances, I would assume. Yeah. I mean, and you can be like, gambling is an addiction, and a lot of people, I think that's hard. It was hard for me to wrap my head around that because I'm like, well, how has your body become physically dependent on
I can tell you about that.
I know.
Yeah.
My mother-in-law, God
but
rest her
for
soul,
me to like understand the science when I was like, I was coming, from drug addiction. I'm like, but you're not putting a drug in, there's not a substance going into your body. How are you? But it's the
rush that you can win.
It's absolutely the rush.
My mother-in-law, I mean, listen, after she retired, she was a widow at that point, and she had it made, and she spent every dime she had, and she ended up with 2 mortgages on her house when she died. It's like, what do you do with it?
And March is actually Problem Gambling Awareness Month right now.
So just so you know, I think I've told you about what I went through, like as far as gambling is concerned. So I don't do anything. I don't buy lottery tickets.
It doesn't interest me.
So my dad recently just gave me lottery tickets for my birthday.
You like this, right?
Yeah. Well, the scratching them is okay.
Yeah.
It's,
all right, I won $2. I'm going to go get
and then
more,
they're still on, they've been scratched, but and I won $10, but they're still on my desk because I don't want to go cash them in.
You'll just get
I'll just
more
parlay.
Yeah.
And
I'll cash it in. I'll give you the $10. I don't care. I mean, geez, be real, Mike. But no, none of this. I play Powerball. If it gets wicked high, I'll go buy 10 tickets or something. But I don't.
I'll overdo it.
I don't.
And I need to stay away from that.
I don't go to the casinos.
But at least you recognize that.
Even on cruise ships, I don't go to the casinos. It's not an interest,
Yeah. It's not for everybody. It's like, I'm not a beer drinker. I know people that have passed away because of an addiction to alcohol and or beer. So sure. It's sad. I think that could lead into something, and it was leading me down a dark road. I was to the point where, all right, this isn't about me. So let's move on. So 10 years.
Yes.
All right. And we've talked about a little bit about fentanyl and how Griswold Pride has gotten started. What I'd like to get into next is where we are now.
Yeah.
And how we got there. And so let's take a quick break, and we'll come back and we'll talk about where Griswold Pride is now. What are you doing? And what I can kind of say right off the bat is that it has changed a lot.
Yeah.
The perception of it all has changed so much from beginning until now. We'll be back in a minute right here on SNSN Sports Community.
Today's program is being brought to you by the Burns Agency in Dayville and Norwich. Home, auto, life insurance, all from a family-owned agency since 1932. Call 860-774-8549 or find them on the web at burnsagency.com and find out why you'll buy better at Burns. The Burns Agency, a Hub International company. Strain Family Motors on Route 12, Lisbon. Quality used cars like the SNSN Strain Family Motors Mobile that you will see at all SNSN sports events. Oil changes, remote car starters, all available and more in their service department. And if you really want to turn up the excitement, rent a Polaris Slingshot for the day and live it up. All available at Strain Family Motors, Route 12 in Lisbon.
So anyway, we're back talking to Miranda Mahoney from Griswold Pride, and one of the things we want to talk about is where we are now. Mm-hmm. So the perception of drug abuse or drug addiction has really changed a lot. And before we get into something let's talk a little bit about Matt's mission.
Yeah. So,
which is another spider web, or that's in the
right, and they're coming up on 10 years too.
Yeah.
It's kind of crazy how all three of us kind of launched around the same time. So Kathy Duffy and her daughter Kelly started Matt's mission after the death of Kathy's son, Kelly's brother, and just to really transform the stigma around addiction. And offer support to families.
Can you explain stigma? I don't know if a lot of people understand. They hear the word, but what does stigma mean?
Stigma is the perception, I guess, of something. So, Kathy and Matt's mission has done an amazing job at really helping to shape that conversation, not just in looking at people with a substance use disorder, but focusing also on be cognizant of the language you're using. So we're not, the addict. No, we don't use that. It's a person with a substance use disorder, person with a opioid use disorder, alcohol use disorder. They're a person first. So that's one of the main things. I think that was, to jump on. And then from there, it just snowballed, And it wasn't just here. I think globally, addiction, the stigma surrounding that has really shifted, which to a good thing.
Well, we've seen it.
Yeah,
we've seen it. And you talk, I mentioned, the whole well, you had talked about it first, and how now you're managing a whole bunch of different parts of the community within Griswold Pride. They're doing the same thing. So it's they came off of you. Now there's a whole tree, right? Family tree of organizations that collaborate with Matt's mission. One that really strikes a chord with me is Today I Matter.
Yes.
And I think a lot of people know who they are without realizing who they are. So if you want to talk about them.
Today I Matter, they're actually Connecticut based too. And they do the poster project with putting faces to the names of everybody lost to an overdose. And you can have your loved one's picture made into a yard sign, and then they display them all over the country. Yeah. It's made its way down to, the nation's capital. There's a little documentary about them, but Kathy has partnered with them and brought them to our community, I don't know, 2 or 3 times now.
A couple times at least.
Yeah. For her Celebrate Recovery events that she used to do in September. And it was a very powerful thing. And I mean, you and I have both walked through there. That was just a fraction of the actual amount of posters that, they actually have.
I know.
Now, do you, other than people that you work with and help, do you know anybody personally in your personal life that has died from an overdose?
Yes. I've lost friends. I've lost family member. Yeah. Yeah.
No,
Yeah.
I don't.
Matter of fact, I was pretty connected to the very first young man
Yeah.
So.
No, there was I would say an 18-month time frame not too long ago where I went to many funerals, and
Really?
it's heartbreaking when you're doing this work and some you people that you're close, you don't even know.
Yeah.
Of course.
You know, and
of course.
There was one within my own family.
Some people can hide it very well. Absolutely.
So we were, there was a saying or something,
yeah, everyone knows somebody, loves somebody, is somebody, or has lost somebody to the
Yeah.
disease. Yeah.
Yeah, it's difficult. It's very, I mean, what do you do? But I think it's amazing, of what this community has become, because before Griswold Pride, the perception was not good.
No.
It was if you were somebody that
hung out under the bridge down here, right?
Right.
Yeah, or
right.
had a
Remember
disorder.
all of that, right?
Yeah. It's like you see him on the street, and
Sure.
it's like, oh,
Yeah.
that's just another drug addict.
And I
Right.
think that Today I Matter really
Changes that.
That's
a bullseye.
Yeah, you're putting a face to the
Right,
person,
right.
and you're showing it's somebody's sister, it's somebody's
Oh, yeah.
mother, it's
That's
somebody's brother, child.
But the perception has changed
Mm-hmm.
180%, and I'm one of them.
Mm-hmm.
Because I you don't know. You just you grow up thinking a certain way.
Yeah.
And then you get educated about certain things and addiction, and you're like, oh, wait a minute. Yeah, that's not really the way that it is.
Mm-hmm.
Then you almost feel bad because it's like, why did I think that?
Mm.
So let's talk about perception.
Mm-hmm.
Well, perception programs. There was an organization,
Yeah.
that had a van.
Right.
I don't think they're doing it anymore. Are
Perception's
they? Or-
actually closed.
They did. Okay,
Yeah.
that's too bad.
Yeah, it is. It was a loss, especially with our community, because they're one of the only outside agencies that, they weren't even in Eastern Connecticut, technically. They're
Right.
in Northeastern. They're part of the Wyndham community. But they made it a priority to take their mobile programs to Jewett
Right,
City. And that was because Kathy never gave up in advocating for us. But,
Right.
they didn't have to do that. They were overstepping. They were going into Southeastern Connecticut, where their region was Northeast, So that was huge for us. And they had the two programs, harm reduction, syringe service, and then they had the medicated assisted treatment van, which was a huge resource. And now both of those are gone, but we do have mobile syringe services through Uncas Health District now. So,
Are they still going to the same place, same day, or?
No, they are at the town hall, be out around the back of the town hall, every Tuesday, I think from 2 to 3. And they provide a whole list of services, as well. So if you need blood pressure, screenings or anything like that, they'll be able to do that too.
So you talk about harm reduction.
Yes.
That's kind of where things are going.
Yes.
Right?
And that
So
was,
that's-
10 years ago, that was like, what are you talking about?
Exactly, yeah.
But no, that whole conversation, because we need to keep these people alive. We need to, if they're going to use, let's make it safe for them.
So with that being said about keeping them alive, maybe you'd like to highlight on what the state did to your program with knocking out the Narcan boxes.
So,
because they're outside
Glad you asked it.
Yeah.
and they're not temperature controlled.
Yeah. So
As part of public health and safety, we
Right.
do these things, right?
Yeah,
I mean,
and we've taken our education to the state lawmakers, who I believe are trying to fix it. We're one of the only states that is mandating that the outdoor Narcan cabinets are temperature controlled. The problem with that is, running electricity, this and that, blah, blah. And they're like $5,000 compared to $300.
Right.
Sure.
So, we had those 3 installed in the community. They were widely used. I think we handed out over 50 boxes of Narcan within those 3 months. Our overdose numbers, while those boxes were in place, was it 0 or 1? It was either 1 fatality or 0. I can't remember. For the beginning of 2024 till the end of June, the boxes were in place March, April, May. Since the Narcan's been removed, since July of 2024, we've had 7 fatalities.
Okay, so let's figure it out. It's not that the math don't lie.
Yeah.
Do the math, right? Yeah.
So we provided this data to our local legislators, and
Kathy even tried even to go past that by putting her phone number on there, her personal phone number
yeah,
on the box that's right here,
yeah.
and call her and she'll come out and bring you the Narcan.
But people want quick, easy, anonymous access.
Yep,
You
they
know,
don't want to know
Yep.
who they are.
Yep. So hopefully that's going to be restored. I do have great news though, and this just passed last week. The Slater Library is going to be partnering with us to place a cabinet inside their building right now while the state works on updating these mandates so we can restock the outdoor cabinets.
So speaking in the terms of anonymity,
yeah.
do you think people will go into the library to access that?
I don't know. I'm gonna actually head over there after this, and we're gonna try to look at different locations where they can grab and go, but make sure it's also a safe place to install it.
And the other problem is you don't have nighttime access.
Right.
So
So
it helps, but
it helps, definitely helps. And hopefully we get, the state updates those mandates. We have another box, right? Griswold Fire Department was ready to put one on their box. And I've even reached out with Tracy Hansen up in Voluntown. Their fire department, they have people drive, that's a highly traveled road.
Right.
They see some people out of staters see fire department and they pull in there looking for Narcan because many fire departments now have the boxes on the outside. So she's like, how are you working around this? I'm like, well, we haven't found a workaround yet, but she's advocating and Tracy's on the state's OSAC, Opioid State Advisory Committee for the Opioid Fund. So she's a great resource and asset for us too.
So I think it's fair to say that the focus of Griswold Pride, just to give you an idea, I mean, like I know for us, it's not odd for your focus to change through the years.
Yeah.
I started off thinking I was going to be the AM radio king of Griswold. Nix that. So then we moved into internet audio, into video, and here we are doing this type of work, streaming sports and all.
She's got one mission and she sticks with it.
Yeah, but
there's no deterrence.
Changed.
But
that's my point. We too, right. Same thing.
Things change here, you make the changes.
Yeah.
Things change here, they march on.
Yeah.
Exactly. So so instead of prevention, you've moved into harm reduction. Was that hard to transition? It was just a natural.
It was a natural organic progression, and it's the whole country is shifted to that. So
the big problem was where we're going to put them, and that was the big issue. Where we're going to put these things, right? Debating all of that.
Oh,
You're talking about the Narcan,
the boxes.
Yeah.
So when did it happen? Where really somebody at some point had to throw up their hands and say, "We realize people are going to continue to use. What do we do to help save these people?"
Right.
When did that happen?
I don't know if it was.
It just happened.
It just was
kind of went from.
Mm-hmm.
It's organic. That's the beauty of it all.
When you have a failing business model, you change and adapt, and I think that's what happened.
Yeah.
The don't do drugs. This is your brain on drugs. That messaging in the 80s didn't work. So
right. Correct.
That's not what I do in the schools. That's not what we do. We are building resiliency. We're coping strategies, stress management. That is how you prevent, drug use.
Right.
No, don't do it. Don't do it.
Is it true that you have to, I know DARE believe that you really have to start the programming in the fifth grade.
Yeah.
Fifth grade.
So the original DARE model was a complete failure as far as drug prevention. And that's based on tons of studies on it, but it was very successful for the law enforcement, relationships and developing that. So, it was a great program. They have revamped it, so it's not what it was in the 80s and 90s. So it's more about making healthy choices now versus don't do drugs, and I would never knock DARE, but it was scientifically not evidence, based successful.
They gave it a good shot.
Yeah.
You have something here that you wanted to read.
Yeah.
Before we go.
So this came to us from Senator Murphy, and it was supposed to be read at the event, and we did not get a chance to do that. Dated March 14th, which was the day of our event. Dear friends, congratulations to all at the Griswold Partnership to Reduce the Influence of Drugs for Everyone. As you gather to celebrate your 10th anniversary, this event celebrates your years of work to reduce and prevent substance use while creating a safe, drug-free environment for the residents of Griswold. I wish I could be there in attendance for what I'm sure was a wonderful event. Since 2015, Griswold Pride has partnered with organizations across the state to raise awareness around substance use. Your dedication to educating the community is evident through your countless workshops, events, and outreach projects. Through your 10 years of extraordinary effort, you have secured over $1.5 million in prevention funding to support your work, receiving the Connecticut Association of Schools Distinguished Friend of Education honor in recognition of your commitment to education, and the United States Attorney's Office Community Policing Award in recognition of your intervention work are both a testament to you, to your unwavering commitment to serving the Griswold community. Thank you to all at Griswold Pride for your tireless efforts to support the residents of Griswold. Your community engagement and leadership amongst your peers has been a cornerstone in our shared fight against drug use. Your service has and will continue to improve the Griswold community. Best wishes as you celebrate this milestone, and I look forward to working with you for years to come. So signed, Senator Murphy. So everybody should be proud from the Griswold community for really building this and getting recognized, the way we have.
Got it. Anything else you want to talk about or you want to mention before we go? And, we'll see you before the 20th anniversary.
Do you want the tobacco compliance checks?
I'm so glad you brought that up.
One failure, right?
One, that's great.
No,
though.
I know.
That's great.
Compared to talk about
year.
the last one and talk about this year.
We were pre-COVID, we were doing alcohol compliance checks pretty regularly.
Yep.
And then we stopped, with masks and all that stuff. And then the last year we revamped tobacco ones. I don't even know when the last time they were done. It was prior to me coming to town. So it's been a while. And, with something new like that, we had, I think, 4 failures last year. Then there was an additional violations for some illegal THC products and whatnot.
That was last year.
And so, but it was hard to get because we couldn't find trained youth in Eastern Connecticut. And all of a sudden I found a contact within the state, like Demas has a tobacco prevention enforcement unit and they're great. So now they come out, we connect them to our resident trooper and they go and do the compliance checks. So we did 16 retailers this year, only 1 failed. And I'm working on creating a decal for the ones who passed.
Right.
I was just going to say,
Yeah. And I've been, I'm going to give a shout out to Andrew over at Petromax because, he's my little thing. I was like, here, what about this? And I was like, well, retailers use it. He's like, absolutely. He took a look at the design.
Yeah.
So, the design's done. I'm just finding a vendor to use to purchase them.
Andrew's a good guy.
Yeah.
Why doesn't Connecticut do like other states? So, my kids both live down West Virginia and North Carolina. And, along the way, you go down there and stop for gas or get soda or whatever. And you go up to the cash registers and they have signs right there that everybody will get asked for an ID to buy cigarettes. They don't care if you're 85 years old and look like you're 110.
Yeah. Our law is 27. If you look 27.
Yeah, but this
or
mandatory.
older,
Everybody has to show an ID. You want to buy smokes, you got to show an ID.
Yeah.
We don't care how old you are or how old you look.
Yeah.
I don't get that.
I don't know.
Why don't they just do that? It's you can still get some non-compliant places, I'm sure.
Right.
Because nobody's watching the house all the time, right?
Right. So
thank you very much, Miranda, for
you.
bringing, all of this information to us today. And it's great 10 years.
Yeah.
And
see where we go from here.
The next 10 years,
10
see
more.
what happens. So
10 more. Yep.
You can always check out what Griswold Pride is doing by going to their website, which is www.griswoldpride.org. Pride, of course, stands for the Partnership to Reduce the Influence of Drugs for Everyone. They ain't kidding. So, and they've done God's work really in the last 10 years. So thank you very much, Miranda.
Thanks for having us.
Great job.
All right, Rich, thank you for coming on in. And we'll be back with some more community stuff real soon here on SNSN Sports Community.